how neurofeedback brain training can help people recover from aphasia. I'm Dr. Trish Leigh. Let's break it down together. In this video, we're going to think about the three main principles in using neurofeedback, which is called QEEG guided biofeedback, to help people recover from aphasia, especially after stroke, since we know that the majority of the time, stroke is what causes aphasia. Okay, so we're going to talk about what the QEEG brain pattern looks like in the three main types of aphasia. Then we're going to talk about how neurofeedback actually works to help people recover from aphasia. And number three, how speech and language therapy can be incorporated to help people bring back as much as possible of their cognitive abilities, their activities of daily living, and their communication abilities. So let's jump right into it. Number one, what does the QEEG brain map of aphasia look like? Okay, so what a brain map is basically a visual representation of how a brain is using electrical energy. So on a brain map, we can see all the areas of the brain and how they're performing, whether they're using perfect processing speed in the middle, or if the brain is running too slow, using too much delta and theta, or if the brain is running too fast, using too much high beta, fast anxiety speed. Now, when a person struggles with aphasia, their brain is using much too much slow processing speed. And it's because the impacted area of the brain has been injured. And so it's been physically injured in most cases, but it also has changed in its functioning. So aphasia is a functional injury, meaning that the area of the brain that controls the skill or ability that is lacking is no longer working at the proper speed. And we're going to break that down in a second when we get to neurofeedback. So on a QEEG brain map, if a person struggles with Broca's aphasia, which is an expressive language disorder, meaning that that person can't get the thoughts out and can't physically put the motor commands together to be able to talk, then Broca's area, which is located more frontal on the left-hand side of the brain, would show that it's using too much slow brain speed, theta and delta, on the QEEG brain map. So what that looks like is a red area of high magnitude of slowness. Now, if a person suffers from Wernicke's aphasia, the area for comprehension is back here. It's still on the left-hand side of the brain, but now it's more back in the brain. Wernicke's aphasia, people can usually say things fluently, they just don't make any sense because the comprehension piece is not there. So the last type of aphasia is a combined aphasia, where both areas are impacted, and that would show up on the QEEG brain map as a whole hemisphere dysfunction and dysregulation of a brain that is using much too much slow processing speed on the left hemisphere. What can also happen, especially in Broca's aphasia, is that there's a dysprosody, meaning that the sensory motor strip across the central area of the brain, and especially in the left hemisphere, is also running too slow, and the motor commands can't be put into place to be able to articulate the sounds that the person is trying to say. That's what the brain map would show. And there's research that shows that indeed this is what brain maps of people with aphasia show, that their brain is running too slow and in the areas that are impacted, and that's why their skills and abilities do not work properly anymore, because it is a brain-based injury. Okay, that's the QEEG brain map pattern for the three. Now, what does neurofeedback do to be able to improve the brain performance pattern of somebody with aphasia? When a person comes in for neurofeedback brain training, after we have their brain map, we see that their brain is running too slow in the left hemisphere, either more frontal, more posterior, or both. Then we know what areas we need to teach the brain to make more of perfect processing speed in the middle and less of that slow speed that's dragging the brain down. So neurofeedback is a learning modality. It doesn't put anything into the brain. It teaches the brain to perform better. So this is why it fits so naturally with speech and language therapy, which we'll talk about in just a minute, because it's basically rewiring the brain to use speed better from a top-down approach. From brain training right in the brain with feedback that's given directly to the brain, which then changes the behaviors of the mind and the body. And in this case, it has to do with cognition and with communication. So brain training is used to improve the areas that show that they're using too much slowness. Now, what actually has to happen for a person during a session sounds like magic, but I tell people all the time, it's not magic, it's neuroscience. And in today's day and age, we have the neuroscience and we have the technology to improve a person's brain for them. You can train your brain to work better, and your brain does all the work and you don't have to. So when people come into my office at Leigh Brain and Spine, or now we have home neurofeedback, you can do it in the comfort of your own home, especially important during COVID-19. But what happens is you use a screen or a device at home, or in our office, you have a deluxe computer that delivers feedback to the brain when it's in the zone and producing more of that perfect processing speed for cognition and communication. What that looks like in real time is a person is watching a movie or a video on their screen. When their brain is making that faster, perfect processing speed, the screen plays bright and the audio plays louder. If the brain goes out of the zone and starts making more of that slow processing speed, then the screen dims and the audio goes lower. And that is the feedback to the brain based upon its own performance. So the better the brain performs, the brighter the screen plays. The worse the brain performs and it uses that slower processing speed, the screen dims. Over time, the brain is taught to make more better processing speed. And it's all neuroscience. So it's called Hebb's Law. Hebb's Law says that neurons that fire together wire together. So when we fire the neurons at the proper speed together continually with consistency and frequency in neurofeedback brain training, what it's doing is using Hebb's Law to get those neurons firing again so that that person can think and remember and communicate and have quality of life. Now, it also counts on anti-Hebbian learning so that the pattern undoes itself of slowness. So the slowness decreases, the perfect processing speed increases through the feedback to the brain, and all the person has to do is watch a movie. It's that easy. It's a passive treatment, and that is why it works. That's why we can work with people on the autistic spectrum. We can work with people who have Alzheimer's or dementia. You don't have to do a thing except for watch the screen, and your brain does all the work. We call it push-ups for the brain. Okay, so let me tell you how speech and language therapy fits into this piece. Before I do though, if you're getting value out of these videos, please like and subscribe because it'll only help the both of us out. Okay, so how does it fit into speech and language therapy? I started as a speech language pathologist, and even though I'm still licensed, I haven't practiced traditional therapy in a very long time because I have been an educator and a cognitive neuroscientist for a decade now. So what I do in my practice, though, is that if I'm working with someone with aphasia, if they don't have a speech language pathologist that they're already working with, I make sure that they get an assessment as they're joining me for neurofeedback brain training, and they get their brain assessed. I look through their assessment. It generally corroborates with what I see in their QEEG brain map. And I definitely want a person with aphasia to be working with a speech language pathologist because I've already told you that neurofeedback brain training is a top-down approach, brain to mind and body. But to get better faster, you need a bottom-up approach also. And that is speech language therapy. You're actually doing the skills that you need to get better with your speech language pathologist to practice your cognitive skills, to practice your communication skills. And when you're doing that behaviorally with your mind and your body, you're also rewiring your brain to work better using Hebb's law. They work together. Top down, bottom up, working together. Two ways of the street, as I always say it. So that is how you get better quicker. That's how the two work together. And if you have a skilled speech language pathologist, you're working on exactly the cognitive and communicative skills that you need to get better, but you also are using compensatory strategies that help your brain heal in the right amount of time with the just right push while you're learning to function better in your environment. Okay, so I hope this video helps you out. You can visit my website at drtrishleigh.com for online personal neuro training and coaching with me. You'll see that there. And I offer full-blown neurofeedback in the office at Leigh Brain and Spine and through our online portal. So you can check that out at leighbrainandspine.com also. Okay, so remember, control your brain or it'll control you.